Morning everyone. Salam sejahtera. Right, I've got a very fancy title. It gives the impression that I spent 1 month in London and then the next month in Kota Kinabalu, which that would be fantasy actually. No. But the reality is that London is my past and KK is what I'm doing presently. Right, so it's my subtle way of putting KK on music therapy map. So for any of you who've never heard of Kota Kinabalu, it's in East Malaysia. On the island I'm getting old with technology. Okay, so it's in East Malaysia on the island of Borneo, next to the Philippines. There we are, here's the map. Oops. Okay. That's where I'm from. And that's where I'm based. So what I'm going to attempt to do this morning is to share with you my experiences from my work in London and the work that I do in Kota Kinabalu. So music in medicine primarily refers to the use of music in a medical setting, such as the hospital, general medical and psychiatric, clinics, hospices, where people are admitted to treat a symptom or a condition and where medical procedures are conducted. So the most common perception of the use of music in medicine is that of listening to music that is usually one's favorite. I mean, that's what is normally done, over here. Preferably slower in tempo, ballad style, velvety textures from its instrumentation and vocals that help provide an ambience of being soothed and relaxed. Well, I'm thinking of musical bubble bath. So we generally hold a view that music is positive and it acts as a supportive holding mechanism for when we experience some difficult feelings and memories as we listen to our playlist. So music per se has therapeutic effects. However, bear in mind that it is a powerful medium that can trigger the opposite of beneficial. So it requires specialist training, followed by being licensed to practice, hence the existence of music therapists. Now I'd like to share a story with you of a mistake I made as a therapist. This happened about 4 years ago in palliative care ward in Kota Kinabalu. So, just okay. So a mistake on my part that led to music being a catalyst that triggered a change on the whole ward. Well, at least I know it works. Right, so it was a mistake on my part, but it led to the whole ward getting involved. And that enabled one patient to talk about the memories of her deceased husband, and for another patient's family to sort out the patient's estate. So it's 8:30 a.m. on the palliative care ward. In the briefing, I was asked to see an 80-year-old woman, stage 4 cancer, who became rather tearful over the past few days and had stopped talking to anyone, including her caregiver. Now, we don't have any hospice in KK, but we have a palliative care ward. It's a unit in the hospital, and the ward is open. It's an open ward. So, you could hear a few soft groans here and there, humming of machines, birds chirping outside, cleaners cleaning the floor. So it's generally quiet and laid back. So the lady I went to see was already awake, and she smiled when I came to her. So anyway, I had every intention of playing this. Gentle, not too slow. She's 80 years old. Instead, this is what happened. My finger tapped on the wrong thing. So it's like I was trying to act cool, frantically switching off this song, right? And the patient I was with began rubbing her ears like this. Aduh, Ismanda, kenapa kau pasang itu awal pagi? Sakit telinga saya. To translate, it's like, oh my young lady, why did you have to switch it on so early in the morning? You're giving me pain in my ear. So, and I thought, oops, I'm so sorry. And all that, 8:30 in the morning, everybody wakes up, and I'm giving pain. Yeah. And at the same time, there was this other patient who was groaning about 20 feet away. So she shouted, siapa itu? Kau mau kasih hidup saya balik? So it's like, who was that? Are you trying to bring me back to life? And then her caregiver was trying to soothe her. And the patients in between these two patients, were wondering why I switched the music off, why I switched that song off. Because they said the cleaner started swaying to the beat with her mop. and I'm sitting there thinking, oh my God, I made such a big mistake. So the nurses and the doctor came to see what the commotion was about, and the doctor said she'd never seen the ward come so alive at any time of the day, never mind in the morning. I just woke up the whole ward. So anyway, the patient I was supposed to see began relating her memories of dancing, the twist with her husband in their younger years, to her caregiver. So she was talking again, and they were concerned that she was not wanting to talk to anybody. And she also suggested to me, could you just go and have a chat with that lady over there who's groaning, who you brought back to life, so she stops groaning. So I went over, and in the end, that groaning lady was convinced that there must be a reason for her to live a bit longer, and so that her family could sort out her estate. So anyway, that's such is the power of music. Okay, so moving on, this next slide shows typical areas where music therapy is applied as a treatment modality. Now, perhaps not all within Malaysia, but certainly it is increasing globally. So, if you think about it, when you have a general perception that music is beneficial, I do a lot of this kind of awareness, trying to explain to people the difference, making a distinction between music therapy and the general use of music. So when you have a general perception that music is beneficial and can be provided for free via listening, be it in the background or via earphones, what then becomes the role of music therapy, conducted by a licensed practicing music therapist for patients who are admitted for medical procedures in a medical setting? The questions of how it is conducted, by whom, for what it is conducted, and how does it fit into the wider treatment plan of the patient that may be referred for music therapy. So distinctions need to be made between the use of music per se in medicine and of music therapy as a treatment modality. So I do a lot of explaining, and I say that the music therapist actually provides an intervention using music, using the different elements that constitute what we say as music in very, very specific ways to treat a particular symptom, to induce something in order to reduce aspects of the symptom, and then to provide coping mechanisms. So far my explanations are working. Okay, so the how of it, we'll be looking at the reasons for the referral, what intervention is used, what is the treatment process, and what are the potential outcomes expected. To answer the by whom would be, of course, the music therapist, using a variety of equipment, such as musical instruments, the voice, listening materials, technological devices, and these are used within a variety of methods available to the trained music therapist. Now, within a medical setting, treatments administered are quite specific. So therefore, the music therapist also has to sort of fit into that model of working. So, for example, to induce relaxation, to reduce agitation, to stimulate arousal, to increase distraction, to decrease pain, or to regulate emotions. That's just to name a few examples. And then we look at how all of this fits into the patient's treatment plan. Will the music therapy play a supportive role, an adjuvant role, or will it be a main intervention procedure? Or perhaps it co-treats alongside another procedure? It is systematic and the therapy is clinical. Okay, so I will now attempt to illustrate the how, what for, fitting into the treatment plan of the points from the previous slides, using cases from my own work, and I would like to share with you from my own experiences of my work from London and KK. Okay, so the first case comes from London. It was a 50-year-old man who had suffered a stroke. I saw him when he was transferred to a nursing home. He was a professional drummer and referred by the speech therapist at the hospital. So this patient's reason for referral was to stimulate the use of gestures and vocalizing. He was referred in the second month following his stroke, where he was not responding to speech therapy towards the end of the first month. So he was prescribed 8 sessions of music therapy. He did not want to play any musical instruments, but he was willing to listen to some music together with another person. So I gathered information of his favorite artist, and in the first session I decided to play Santana. It happens to be a favorite of mine as well. So during the course of the treatment process, he began by engaging with my questions and reflections of what we were listening to, with the use of gestures. Some would say when it's good or bad, head nods, head shakes, changing facial expressions, shifting gaze. Yeah. Can you hear me in the back now? Okay, so anyway, this then progressed to spontaneous vocalizing in response to the music, then to the use of single words, and then short phrases which were slurred, and finally progressed to increased clarity in his pronunciation of words. So the outcome at the end of the sessions was a huge progress for this man, in that he achieved his ability to communicate his immediate needs and then sustain a simple conversation, and his self-esteem improved very much. So, how did the music therapy fit into this man's treatment plan? See, it was the main intervention during the second and the third month following his stroke episode. The second case comes from Kota Kinabalu. It's a 34-year-old woman, stage 4 breast cancer. She had 3 young children, and the referral came from her attending doctor, who requested that the music therapist assist the nurse by engaging the patient whilst she is undergoing her dressing procedure. So this patient's reason for referral was to help her begin to feel relaxed during the dressing procedure, which was very painful and very stressful for her. So the music therapy was only administered during her dressing procedure. She chose vocalizing to oohs when she felt no pain, and then ahs when she felt pain. And then she chose facing the Kaaba in the holy city of Mecca with her children as her fixed imagery. That's a very strong, very powerful imagery. So I supported her by vocalizing along, which is what she requested. So as she engaged with the vocalizing and with the imagery, she became increasingly distracted from the pain, and the nurse was able to perform the procedure smoothly. So the outcome was that she managed to cope with the entire procedure feeling less pain and without ending up in tears. So, how did the music therapy fit into this patient's treatment plan? It was co-treatment that was administered only during her dressing procedure. Okay, my third case is also from KK. The patient was a 52-year-old man who had been experiencing panic attacks and anxiety symptoms. He was on Lexapro and Xanax to treat the symptoms. He was referred by his physiotherapist, actually, who had noticed that he was easily tensing on her treatment. He's an active sports person. His referral was supported by his doctor and clinical psychologist. So this patient's reason for referral was to develop relaxation tools for coping with his triggers and when experiencing the symptoms in his body. So once he began to cope, the psychiatrist recommended that he stops using Xanax. So this patient came to my clinic for his sessions. The intervention used was the Bonnie method, guided imagery music, but without the mandala drawings after the imagery, as he requested his preference for verbal reflections of his imagery. So I gave him some practical tools that focused his attention towards his breathing at the beginning of his sessions for him to apply whenever he could feel the symptoms coming on. His imagery, as you would imagine, was dark, sometimes overwhelming, and he experienced some very, very difficult emotions linked to his past. But once he had experienced these within the sessions, his images began shifting towards positive ones, including positive images from his childhood. And towards the end of the 3 months, he eventually said goodbye to his dad in one of his images. And if you remember from the previous slide, his dad had committed suicide. So the outcome for this patient was that his anxiety symptoms actually did reduce, and he stopped experiencing panic attacks, which then enabled him to discontinue Xanax. So then you would wonder how the music therapy fit into this patient's treatment plan. It was an adjuvant that helped deepen the psychotherapy treatment he was receiving from his clinical psychologist, where he could reflect upon the imageries occurring within the music therapy that did not occur to him during his psychotherapy process. Okay, so my final case comes from a rehab ward at a psychiatric hospital in London. It's a 70-year-old woman, early stages of dementia, was experiencing unstable emotions, sometimes agitated, other times incessantly crying. She swore at people freely, and she had this notion that she needed to be suspicious of the ward staff. Otherwise, she was convinced that they were going to kidnap her. So this patient's reason for referral, she was referred by the occupational therapist on the ward. It was to regulate her emotions, which would reduce her agitation, and that would enable some sort of cooperative behavior. This patient was seen on the rehab ward for 12 individual sessions. Her intervention was improvising at piano in duet with me as her therapist. So during her initial sessions, she would tell everybody to bugger off and not disturb her special time at the piano. And only the therapist was allowed because apparently she was not suspicious of me. So her treatment process focused on freedom of expression, though through her improvisations, which then developed into thematic work until she achieved organizing her improvisations into her own composition, where she included lyrics, and then she wanted to perform this to the other residents, and she promised to be nice and not swear at her audience. So her outcome was that she actually achieved being less agitated and could bring herself to be a little bit more pleasant with people. But this patient required ongoing therapeutic support to help her regulate her emotions. So how did music therapy fit into this patient's treatment plan? It played a supportive role, and it was something that she required over the longer term as she transitioned from the rehab ward to a nursing home. So, with what I have shared with you this morning, you might be wondering if there is a future for more. I can't control the mic. Systematic use of music, or in other words, music therapy, within various medical settings in this country. Well, I think there is. But it will take time and concerted effort from all affiliated agencies to enable accessibility towards this treatment modality. Okay, funding is an issue everywhere, whether it is provided from an external source or made available internally by the organization of the hospital. So then this will affect the creation of jobs and posts, and then there's the issue of providing local research. We don't have, there's hardly any local research. You know? To strengthen the reasons to fund in order to provide the accessibility for this therapy. So just to give you an idea of what's current in my practice, I now run a specialist music therapy clinic based at Jesselton Medical Center in Kota Kinabalu. It's a local private hospital. It's relatively small, but it's popular and it's very busy. So I am visiting consultant, and I share my clinic with the audiologist, who is resident consultant. So I'm working on grounding the service for the pediatric population whilst building on the adult cases. I've been very lucky in that I was actually offered this role to establish the clinic in a hospital by the resident psychiatrist, who's hoping to establish Jesselton Medical as a base for psychological therapies. And for me, it is a very supportive environment, and the hospital's emphasis on my practicing license. I hold my practicing license with the Health and Care Professions Council in the UK, and that has been from, just to give you an idea of how old I am, 1999. So the hospital's emphasis on this is actually helping the public realize the viability and the efficacy of music therapy as a treatment. So, on that note, I hope you enjoy the conference, and in my mother's language, Kota Kinabalu. Thank you.